So on the other hand, if there's too much iron in your body, you'd have hemochromatosis. And one of the reasons you might have hemochromatosis is it could be hereditary. So if you have the HFE/TFR2 mutation, that means you can't switch hepcidin on. And if you can't switch hepcidin on, then you can't bind to, internalize, and degrade the ferroportin efflux channels. And therefore, you'll have too many of those, too much iron absorption. So that will be one cause of hereditary hemochromatosis. Also, if you have a hepcidin mutation, then you might have juvenile hemochromatosis. So these are both essentially hereditary hemochromatosis. And this is more common in people of Celtic origin. And remember, iron mediates free radicals, which is why it's bound to ferritin in the cells. So if you've got an accumulation of iron in the tissues and you don't have enough ferritin to keep up with the inert storage, then because it mediates free radicals and it's very toxic, you'll get organ damage. So you'll get liver failure and also pancreas failure. So you'll get diabetes because of the destruction of beta cells in the pancreas. So you'll get diabetes. Also, because iron is very toxic, you get cancer as well. And the treatment for having too much iron in your body is phlebotomies. So that's regular donations of blood to lower the levels of iron in your body. So looking back to iron deficiency anemia, seeing sort of like what the cause is and the incidence is in the developed and developing world. So first of all, looking at the developing world, it has a 30% prevalence in the developing world. And the cause of the iron deficiency anemia is iron deficiency, which is exacerbated by infections such as malaria, HIV, hookworm, and TB. Therefore, the World Health Organization recommends improved nutrition to increase iron intake, and also control infections, because these infections, malaria, HIV, hookworm, and TB, they exacerbate the iron deficiency anemia even. Whereas in the developed world, so this is more the West, it has a very low prevalence of 2 to 5% prevalence of iron deficiency anemia. It's one of the common causes of referral to gastroenterologists, and the causes could be menstruation or blood loss from the GIT, because remember, menstruation, you're losing blood, cancer, non-steroidal anti-inflammatory drugs, and also celiac disease, which I'm going to explain in a second. So iron deficiency causes and prevalence varies in the world, developed and developing world. How are you going to treat the iron deficiency anemia? Well, if you have iron deficiency anemia, there's two treatments in the treatment strategy. You can have 200 milligram ferrous sulfate tablets, so this will give you more iron. And also 250 mg ascorbate, which is vitamin C, so that will keep iron ferrous. Remember, the ferrous form is the form that's more easily absorbed. So this is the iron treatment strategy. But you should also, if someone has iron deficiency anemia, you should also check for celiac disease. Well, what is celiac disease? Well, celiac disease is an autoimmune disorder of the small bowel. And essentially it's a reaction to a substance called gliadin, which is found in gluten, which comes from wheat, barley, and rye. So if you have wheat, barley, and rye, then you have a gluten intake into your body. And that contains a protein called gliadin. In the body, in the small bowel, the gliadin is modified by transglutaminase, which causes a cross-reaction with the autoimmune system. And it reacts and causes inflammation. And if there's inflammation in the small bowel, because remember the small bowel has crypts of Lieberkühn, and then it has villi at the top. So if there's inflammation, then there's crypt hyperplasia. The cells in the crypts will, get inflamed. So that's crypt hyperplasia. So it means you'll lose these villi atrophy, right? And if you lose the villi, then you've got less surface area. So you're going to get insufficient absorption, which will cause iron deficiency anemia because you're absorbing less iron. It'll also mean that because you're absorbing less substances, the water potential in the gut will be a lot lower. So water will not be absorbed into the body, so that'll cause diarrhea. If you're not absorbing enough nutrients, you also get weight loss and malabsorption, and it will also result in fatigue. Why will it cause fatigue? Well, if the water is moving from your blood into the gut because of the low water potential, because of the villus atrophy and low surface area and the malabsorption, then you'll get low blood pressure, causing fatigue and tiredness. How are you going to diagnose it? Well, the villus atrophy, you can see this in a biopsy. Remember, a biopsy is when you take a physical sample of the cells, and that's called a biopsy. That will show you the villus atrophy and crypt hyperplasia. Also, remember, because it's being the gliadin protein is being modified by transglutaminase, the autoimmune system is reacting using these things, transglutaminase antibodies. So this is part of the diagnosis. If your body has transglutaminase antibodies, it's a clue that the autoimmune system is reacting with the transglutaminase in the bowel. Okay? And in terms of treatment, well, the only treatment really is a gluten-free diet to stop this gluten intake. So again, just to see this celiac disease diagnosis, it's essentially the presence of transglutaminase antibodies, and you'd also do an intestinal biopsy to find villus atrophy and crypt hyperplasia. Another cause of chronic inflammation, the inflammatory bowel disease, ulcerative colitis, that can also cause iron deficiency anemia. Well, why is that? Well, ulcerative colitis, which is an inflammatory bowel disease, first of all, it causes blood loss because of these ulcers. And secondly, it also causes inflammation. Now, if you remember back, inflammation triggers the liver to produce more hepcidin. So if you've got more hepcidin, they'll bind to the ferroportin channels. It will cause the internalization and degradation of ferroportin, stopping you from effluxing iron into your body across the basolateral membrane. So you'll get anemia of chronic disease as a result of ulcerative colitis. Now, how are you going to treat this anemia of chronic disease from ulcerative colitis? Well, you can use IV iron to bump up the levels of iron in your body, and you can use oral supplements of iron, such as the ferrous sulfate and ascorbate to keep the iron ferrous. However, this iron that you're inserting into your body, it can also cause cancer. If you have inflammatory bowel disease and you put iron in the gut, then it will cause, iron can cause more inflammation and cause cancer. So iron can make inflammation worse, causing cancer, possibly. So essentially, inflammatory bowel disease is a risk factor for cancer because the iron in the gut can make inflammation worse. Now looking quickly at the SGT, if you remember, gastric acid is, obesity is one of the causes of chronic anemia of chronic disease, because obesity causes inflammation. So one of the treatments of anemia of chronic disease is bariatric surgery. So bariatric surgery can reduce the capacity of the stomach and also reduce appetite. And if you reduce the appetite and reduce the capacity, you'll lower the obesity. If there's less obesity, then there's less inflammation. If there's less inflammation, then there's less hepcidin production. Remember, inflammation triggers hepcidin production. And if you've got less hepcidin production, then you've got more iron absorption. So therefore, it will treat the anemia. What types of bariatric surgery are there? Well, here's a couple of types. Well, there's gastric bypass surgery, in which part of the stomach is stapled. And there's also adjustable gastric band, which isn't really surgery, but it's adjustable gastric band. What that is, it's a band around the upper stomach to reduce capacity and reduce appetite. So I've summarized that here as gastric bypass and adjustable gastric band are bariatric surgeries that can treat anemia of chronic disease by lowering the inflammation, therefore causing less hepcidin production and more iron absorption.